Hello, welcome to the University of Utah. My name is John Inadomi. I'm the chair of the Department of Internal Medicine. And the first thing I have to tell you is that this is not an interview. This is a recruitment visit. Not just a recruitment for residency, but rather a recruitment for a future fellowship and hopefully a recruitment for a future faculty position. That's how I view this process. And I hope you will be viewing that the same way. This is my fourth month as a department chair, and I wanted to let you know about some of the reasons I came to the University of Utah, and hopefully these are the kind of things that will resonate with you and hopefully allow you to understand how this is the place for you. There's three things in main. One is the level of collaboration. Now, I've been to a lot of different places in my career. It's University of New Mexico, University of Michigan, UCSF, University of Washington, and they're all very collaborative places, but this place has got collaboration just to a different level. And it's collaboration through all aspects of our organization. That's between departments, between the hospital, between the different organizations within our university. It's between education, it's clinical care, it's research, all levels. And that's the thing that really stands apart from other organizations. The second part is innovation, or this pioneer spirit. You'll sometimes hear it maybe called the Wild West. And that's mainly because of the fact that it's a very bottom-up organization. If you've got a great idea, you can run with it. Nobody's going to get in your way. And the most important part is that we understand that the people who really understand how to optimize a process, an environment, an idea, are the people who are actually doing the job. And so good ideas rise to the top. And that is something that we highly support. The third thing is a little bit harder to explain, and that is that despite being an outstanding organization, outstanding department in school, people are always striving for something greater. I'll give you some examples. So in clinical care, we've already been ranked in the top 10 of Vizient quality and accountability for 11 years in a row. This is a feat that's almost unparalleled with any other organization, and yet we're still striving for more. For research funding, University of Utah surpassed a mark of over $600 million in annual extramural support. And still, we are striving for more. And in terms of education, we have a wonderful system in which you get to train at a community programs and practices, a tertiary quaternary hospital and program, a VA hospital and clinics, a cancer center and hospitals, and many other opportunities. And yet we still want to aspire for greater heights in all aspects of academic medicine. And I don't say these things trivially. These are things that are very different from other organizations, and hopefully you will feel that as you visit other places in your travels. I'm going to give you some examples of some goals we have for the department. Those are four main pillars. First is education. I want to ensure that we increase the collaboration between departments. Clinical care and education cannot be siloed anymore. The continuum of patient care crosses departments, so should educational opportunities. And I think that's really important. It's a very multidisciplinary environment in which you will practice, so it's a multidisciplinary environment in which you should train. Second is that we want to prepare you for the changes in healthcare. As we change from a fee-for-service to value-based reimbursement, as we change from siloed hospitals to integrated health systems, as we move toward a model of population health, these are the kind of things that I really want you to be able to experience. And I think that those are the areas that we can expand on that other institutions maybe aren't ready to do so. Finally, I have a great commitment to mentorship of students, residents, and fellows. I have another additional commitment to the faculty in the same manner, but the depth and the breadth of our mentorship is something that I really want to focus on. In terms of patient care, I think I've intertwined these with education, but I certainly want to understand that we are moving from a process by which we focus on treating the most severe complications of disease in the hospital in a highly specialized environment. We want to move that and emphasize the fact that we want to prevent disease and keep people healthy in their homes. And that's a different mindset, and that's certainly something that is shifting, but something that is necessary in order for us to improve the quality and bend the cost curve. We also want to increase our national recognition for exceptional healthcare as a provider and a clinically integrated healthcare system with really top-ranked quality and safety and efficiency. Third, for our research goals, like I said, we've already reached great heights. But for the department, I really want to increase and enhance that environment of curiosity and lead the nation in our chosen fields of discovery. We want to recruit and retain very innovative, creative, collaborative scientists, spanning that spectrum from basic to translational, clinical, health services, and implementation science to complement what we're doing in clinical innovation as well. We do have a vision for expanding our research portfolio, and certainly from the department standpoint, I have a goal of increasing our national reputation for excellence in research as benchmarked through extramural funding. Finally, we have a fourth pillar, and that is equity, diversity, and inclusion. And this is something that I've been focused on for many, many years. I do believe that we can collaborate with efforts at the university and the school in terms of establishing a culture of anti-racism and increase the diversity of our faculty, staff, and of our trainees. I do want to develop a culture in which everyone, trainee, staff, faculty, feels equal. They feel included, and they feel like they belong to our department community. So I hope this experience today will allow you to realize, as I have, the endless possibilities here at the University of Utah in the Department of Internal Medicine. And whether you have career plans for primary care or hospital care or a subspecialist, you have a home with us. So I thank you for taking the time to visit with us. And again, in your recruitment, I hope that you will understand the same kind of excitement that I feel coming here as a new faculty member, and that we truly live up to our motto of medicine elevated. Thank you.